Perfect. Thank you so much, Jay. Island, yes.
You ready?
Yes, I am ready.
All right, everyone. I'm going to go ahead and introduce our speaker. We're going to get started. As many of you know, my name is Jackie O'Hara, and I'm the Fire Life Safety Educator here in Manhattan at the Manhattan Fire Protection District. Today our speaker is Jay Hyland. He is from Jewel, and he is a pharmacist. And he has a wonderful presentation for everyone. If at any point you have any questions or you need assistance with something, please feel free to ask myself, Detective Duffy, Fire Life Safety Educator Marissa from New Lenox, and Officer Simon as well. If you have not been here before, the exits are located on this wall here and here as well, and the bathrooms are in the hallway. Thank you so much, and enjoy your presentation.
Right. Thank you so much for having us today. So again, my name is Jay. I'm one of the patient care pharmacists that works for Jewel Pharmacy. So I kind of represent some of the jewels in this area. I cover a lot of the stores for our clinical, some of our clinical services that are more of a sit-down appointment. So I kind of cover those, so therefore I cover a lot of stores in relation to that. So just as she was saying, if you have any questions related to me, or related to the Jewel Pharmacy, medications, anything like that, feel free to just interrupt me, raise your hand, whatever is comfortable for you. You don't have to wait until the end to ask me any questions that you may have. And then if I don't cover something, or if you wanted to cover something, just let me know and we can cover that information as well. I do have two individuals with me today as well, so if you had special questions for them as well. So we have a current one of our pharmacy residents, so Emily for that one, and then we also have one of our business summer interns, Lexi. And Lexi is actually based at the New Lenox store, the one on Laraway for that one. So that's her main store that she's at. All right, any questions as we start the presentation? Burning questions? All right, perfect. Let me know if you think of any. So I wanted to talk a little bit about some of our patient care services, the history that we've had at Jewel Pharmacy. So for many years we've been providing a patient care experience for our patients, for our communities, and so that kind of all started with us providing pharmacy, kind of generic pharmacy services that began a long time ago. Then we started with diabetes care, which was a little step away from the traditional side of pharmacy. That was in 1994. Then we started providing adult immunizations in 2000, medication therapy management in 2005, which is a big fancy phrase for basically how can we help you with your medications, ensure you're on the best medications, the most appropriate medications, how can we keep you safe for those medications. So it's kind of a lump sum or something which you would call medication therapy management. And then we had wellness services for 2006, which kind of focused around preventative medicine. So how can we prevent some of these long-term conditions? And then individuals who do have long-term conditions, how can we keep you healthy longer? So one of our major services that we offer is immunizations. So have any of you ever gotten a vaccination from a pharmacy before? Okay, so a lot of you. So yeah, so we do offer vaccinations at the pharmacy. I still occasionally do run into somebody who was unaware of that. So we offer it, it's very convenient, we're very accessible. You don't have to make a special appointment, you can kind of just walk in, let us know what your insurance is, and then we'd be able to provide that vaccine. And we can even send that record to your doctor. So some of the immunizations that we offer are influenza or flu, pneumococcal, which is also known as pneumonia, tetanus, which you might also know as like Tdap, so those are the different components in there, which has that pertussis part, which is the whooping cough. So if you've heard about, so if you have, if there's small children around, if you have grandchildren, anything like that, that's typically recommended for the individuals around the infant to help protect them, because they can't get protected from that until a little bit later in life, and it can be very serious if they come down with that condition. Then we also offer hepatitis, so hepatitis A and B, meningococcal, shingles, and HPV. So we wanted to talk a little bit about some of the vaccines that are most commonly, we get the most common questions about in relation to as we age. So one is with pneumonia. So we wanted to talk a little bit about what even is pneumonia. So how many of you have heard about the pneumonia vaccinations? So probably most of us, yeah, at some point we've heard about it. For that one. So, but what is pneumonia? So it can be kind of confusing. Some of the symptoms may relate to other things that may be going on, a cold, walking pneumonia you hear a lot, those kind of things. So it's an infection of the lungs, most commonly caused by bacteria. So there are different kinds of pneumonia. So you can have a viral pneumonia, or you can have bacterial pneumonia. But the bacterial pneumonia actually is the more serious one. That's the one that causes the most hospitalizations, causes the most death. So that's the one that we want to focus in on trying to make sure that we're preventing, because it can be a very serious condition. There's also various routes of infection. So it can be basically anything with a mucous membrane, so our eyes, our nose, our mouth, anything like that, can kind of transmit that pneumonia or that pneumococcal bacteria, as well as if you were to sneeze or cough or anything like that. I don't know if any of you have ever seen, they'll sometimes have like a black screen and they'll have somebody sneeze and they'll see how far the sneeze goes, and it goes very, very far. It looks very gross. So that's kind of one of the routes of transmission for pneumonia. So even if you don't come in direct contact with somebody, you could transmit that pneumococcal infection. All right, so what are the risk factors? So if we know who's at highest risk for the disease, then we can help to try to make sure those individuals are as protected as possible. So one is age. So as we age, it just puts us at a little bit higher risk of contracting pneumonia. Cigarette smoking, because it can affect our lungs, can cause an infection more easily, a better environment for an infection to occur. Alcohol or narcotics abuse, also just use, not necessarily, if it is abuse, it's a higher potential. But if you were, say you had an injury and you were having to take pain medication or anything like that, then that actually can sometimes increase the risk of having pneumonia because it can slow your breathing. So it can kind of make it a little bit more difficult for you to get rid of things out of your lungs. Underlying medical conditions, there's a long variety of medical conditions that we'll talk about. Chronic pulmonary disease, so anything going on with your lungs that make your lungs maybe not having a little bit of an issue. Asthma, taking a proton pump inhibitors. This is a common medication. There's even over-the-counter versions where you can just get right off the shelf. You don't have to have a prescription for. Some of the examples would be like Prilosec, the generic of that is omeprazole, Protonix, or pantoprazole is a generic form of that one. Mm-hmm. So those can put you a little bit higher risk of pneumonia. They've just shown that in the studies. So any questions related to that? Any questions for that one? So if you were on this medication, it doesn't mean that you're going to get pneumonia. It just puts you a little bit higher risk, so you want to be aware of that. So that would be extra important for you to be protected through vaccination, and then also just protecting against normal hygiene of washing your hands, trying to protect yourself from anybody who may be sick. So this gives you also an example of what a good lung looks like, or kind of like a healthy lung, and then what a lung looks like with pneumonia. So you can see that all that kind of white area is where there's no good oxygen. So there's good oxygen all throughout the lungs on both sides for that one, and this side, it's only here and here for that one. So you can think about how much more difficult it is to breathe during that, and how much that you want to prevent that from happening, because that's no fun from that standpoint. So one of the first vaccine that's typically recommended for individuals who are 65 and older is called Prevnar 13. It's the more recent of the two pneumonia vaccinations. So you probably have seen some commercials related to this one that they'll talk about how it's one, you can do one to try to prevent, and they'll have like, you can eat one asparagus or one, you have one fruit from that standpoint. So this helps to protect against 13 different forms of pneumococcal infection, and it can decrease the risk by 45.6% of individuals who are 65 and older. This vaccine, the Prevnar 13, is typically recommended mainly for people who are 65 and older. I will talk about the next one will be Pneumovax 23 is the other vaccine. That one has a larger group of individuals who receive it even under 65. So Pneumovax 23 is the other one. So it protects against 23 different types of the disease. So a lot of times people will say, I want to get the 23 one, because I think it's more for that one. So it does cover 23 different strains. So you may initially think like, oh, I want the better one, the one that has 23. But because Prevnar is newer, what they did is they found the strains that cause the most kind of bad situations of hospitalization and worse. So because Prevnar is newer, then they say that that's the more accurate strains for what they've shown in studies. So they want you to get that one first, because that's the one that they kind of are seeing as the heightened strains. Also, the Prevnar 13 and the Pneumovax 23, those are totally different strains. So when you get them together, then you have your 36 strains that you will have been covered from those vaccines. It's not that you're getting 13 and then adding only a few more with the Pneumovax 23. So for the Pneumovax 23, it's a 57% disease reduction in all patients who receive it, and then there's certain groups of people that should receive that Pneumovax 23 even under 65 because they're at higher risk. So some of those situations are individuals who have lung conditions, congestive heart failure, coronary vascular disease, which is kind of, you may have something going on with the function of your heart related to having a stroke, having a heart attack, anything related to that, diabetes, and then immunocompetent patients aged greater than or equal to 65. So basically that's individuals, anybody who's over 65 and older. And so that reduction is 65 to 84% disease reduction. So that's a significant decrease in the individuals who do not get pneumococcal infections after getting their vaccination. So the timing of administration, so this can be a very confusing slide, so you can ignore it if you'd like to, but basically the idea is that when you turn 65, you would want to get Prevnar 13, and then a year later you would want to get Pneumovax 23. And so the confusion from this chart comes from if you needed to receive it before, Pneumovax 23 before you were 65, then you need to wait 5 years before you get the next Pneumovax 23 for that one. But as a general rule of thumb, you basically just want to receive both the pneumonia vaccinations after 65, at least a year apart on that one. So are there any questions so far? I know that I have been throwing a lot at you, but any questions in relation to concerns about the pneumovax or pneumonia vaccinations, and then any questions about which one you should be getting, who should be getting it?
Okay. Too late.
What was that?
I said I've had them already. It's too
That's
late.
good. That's a good thing. That means that's a good
No
thing.
questions.
No problem. No problem. Yeah, no, it's a good thing when you received it, and hopefully you received it, at the earliest time, kind of the best time to protect you against that. So that's completely fine. So now we'll kind of move into shingles. So I don't know if you've heard that there was a new shingles vaccine that came out. So there's been a lot of questions related to that. So if I can answer any of those that you may have. So what is shingles? First off, we want to talk about that. So who has known somebody who has had shingles before? So it can be, does anybody want to describe what was the situation that they had experienced or somebody else had experienced?
Painful.
Yes, very painful. So with the shingles, oftentimes you'll kind of imagine like a rash for that one. So this rash can be very small. It could be a couple little blisters, or it could be a humongous rash across your whole body. It can cross kind of any parts of the body. So it could be affecting the eyes, could be affecting the mouth, face, anywhere. It can touch your torso, and then it can cause pain, very excruciating pain, and sometimes that pain can actually be permanent. So it's kind of called a neuropathy at that point. So sometimes in the healing process, that pain never goes away. So obviously it's something that you would want to prevent from that standpoint. So it's known as herpes zoster. So if you heard the word herpes zoster, that just means shingles from that one. And it's caused by varicella, which is the same virus that causes chickenpox. So I get a lot of questions in relation to, I didn't have chickenpox, or I wasn't sure if I had chickenpox, when I was younger. That one. So basically, anybody who's over the age of 50 has come in contact. It's a very, very small percentage of people who have not come in contact with chickenpox. And so that doesn't mean that you had a full-blown chickenpox kind of case in that situation, but it could have been that you had one little pock. It could be that you just didn't show any outward kind of expression of it. You could have had a little fever, whatever it might be. But most people have actually had the chickenpox at some point. It's just that it's not always this full-blown body kind of rash. So the virus can come back later in life and cause shingles. So once you have that chickenpox virus in your body, it sits in your spinal cord, and then it can come out as shingles at any point in your lifetime. And you can actually get shingles over and over again. So 1 in 3 people will have shingles from that virus that sits in our body, that one, and then of those people who get shingles, they could get it over and over again at that point. So that's just an image of kind of an example of a shingles that was on their face. So it can be very serious. So the risk factors, so talking about who are the individuals that we want to focus in on. So people at highest risk include individuals 60 years in age and older, but the FDA actually recommends at 50 years and older because they're actually seeing a trend that individuals are actually increasing their likelihood of having the shingles as we are getting younger. And that just kind of has to do with vaccination from the chickenpox virus itself for younger individuals. So individuals who have a weakened immune system are at much higher risk, affected by cancer, and taking certain medications. So typically the individuals or the medications that would be related to would be related to your immune system. So if you have something that affects your immune system, then that typically puts you at a little bit higher risk of contracting or having shingles present itself. So the new vaccine was called Shingrix that had come out about 1.5 years, 2 years ago or so now. at that point. And did anybody get the old shingles vaccine? The Zostavax for that one was the older one. So this is the newer version, or kind of newer version of the shingles vaccine, and it's much, much more effective, which is a good thing because the Zostavax was the old vaccine, and it was decent protection. It was about 50% protection against the shingles, but the newer vaccine is actually up to 97% effective. So very, very few people will get shingles after having received this vaccine, much more so compared to the old vaccine. So the CDC does still recommend you to get the newer vaccine, even if you got the older one, because of it's so much more effective at helping to prevent against shingles. So they also did they have like the 88.8% efficacy in patients of greater than or equal to 70 years old. So this is actually pretty unusual that they will do studies for individuals who age for that one. So a lot of times drug companies want perfect data, so they'll pick healthy middle-aged people, whatever it might be for that one. But they actually were able to show in the studies they included elderly individuals, and they were able to show that it was still very effective for that one. So that's good for safety data. So that should help you feel comfortable that it's safe for you to receive, as well as it's effective for that one. So that's two great things that did come out kind of from the study of the new vaccine. So who should get this vaccine? So the ACIP recommendations, and ACIP is just a company or kind of like a subgroup of the CDC, and they help to make it very clear of who should be receiving vaccines and who shouldn't, and those kind of things. So their recommendations were healthy adults age 50 and older, adults who were previously vaccinated with Zostavax, was the original shingles vaccine, and then Shingrix is preferred vaccine for the prevention of shingles and related complications. So that's just meaning over Zostavax. That pretty much nobody really gets Zostavax anymore because the newer one is so much more effective. The administration it's a 2-dose series, and once you administer the first dose, the second one you get at 2 to 6 months after the first dose. There has also been some supply issues. So if you pass that 6-month time frame, if there was issues with getting it in, that's completely fine. So the CDC and also the company that makes Shingrix, that one do not recommend you to restart the series. You just get it as soon as possible to help get you that protection from that final dose of the series. Any questions so far? Okay.
I had a friend who actually had some complications from this.
Yes, let me see if there is.
Yeah, she got ill from it.
Okay, I don't think there's a slide on it, but I can talk about it. So by far the most common side effects for this vaccination in particular for the shingles, the pneumonia vaccinations generally is similar to like a flu shot for that one. So if you ever received a flu shot, it's very, very similar kind of potential for having soreness in the arm and those kind of things, having a low-grade fever. For the Shingrix, for that one, it's actually similar to, if you remember last time you got a tetanus shot. So it can be pretty decent soreness in the arm. So that's very common. It's up to like 50+% of people will have, pretty strong soreness in their arm. So just be aware of that will occur, or odds are that will occur. As well as you may have redness. So a lot of people will have, it'll almost look like they got sunburn on their arm. For that one, that is also very common, not harmful for that one. It's just, it can be a little bit, profound from seeing like the redness on the arm. You may also have warmth in that area. That's just a portion, that's just how kind of your body handles the absorption of the vaccine into your body, and so some people just have a stronger response to that. The things that you would want to look out for in case, I'm not sure if for your friend's situation, do you want to describe what was the...
like nausea, just not feeling well.
Mm-hmm. Yep. And so that can actually happen with any vaccine. So when you receive a vaccine, what happens is your body has to take those bits and pieces of the vaccine, and they have to replicate, or they have to make a bunch of protection cells that like help to protect you against that. And so that takes a lot of energy. So especially if you were already kind of under the weather a little bit, or if your kind of immune system's not doing so good, you can actually that can use up a majority of your energy. So some people feel very kind of cruddy when they receive it, but it's not necessarily the vaccine that's causing that. It's that your body is using up all that energy. And what I usually tell people who experience that, as long as it's not an allergic reaction, so there's like a different category of anything that, you know, you could have an allergic reaction potentially to it. That's just, you know, something to address. That's a safety concern that you would want to make sure that you go to the doctor immediately if you felt like you were having an allergic reaction from it. But the normal process of the vaccine, you can actually take like Tylenol and those kind of things. That does not affect the vaccine from working. So you can just, I always tell people pretty much with shingles to just kind of take Tylenol the night, you know, that night before, or the night after, I'm sorry. Just to help prevent against that feeling, because it's not going to affect the how well the vaccine works for that one, but there's no reason for you to suffer through the soreness or the feeling of like a low-grade fever, kind of feeling a little junky. But it's actually your immune system that kind of causes that sensation or that feeling of not feeling so good.
Thank you.
Yeah.
For the first dose, I didn't have any side effects. There was the second one where I had joint pain.
Yes. Yes.
Through the whole body, but it only lasted for a day, so it was well worth the use.
Yeah, exactly, and that's the biggest thing is you always want to look at the benefits and the risks associated with it. So the benefit of getting the vaccine is that you can be up to 97% effective. So basically, very low likelihood that you'll have shingles in your lifetime. And shingles, you know, sometimes you're talking months and months and months of time of dealing with the rash. You know, it could get infected. You could be talking about permanent nerve damage, or at least, you know, during the time when it's kind of spreading, that it can be kind of very serious pain. And then otherwise, you may be talking about, you know, having some soreness in the arm, having redness, having, you know, some of those kind of muscle pain, kind of fatigue, kind of feelings from that one. But that's usually a very short-lived kind of time frame from that standpoint. So it's not to say that you will not experience any, you know, that it'll be perfect. You'll get the shot and nothing will ever happen for that one. But it's the idea that what's the benefit and the risk kind of from receiving it. So, but great question. Any other questions anyone have? All right. Perfect. All right. So for individuals who can't make it to Jewel for that one, so we know that sometimes it can be difficult to come out, especially certain weather. Maybe you just aren't able to drive out to the Jewel. Don't worry, our pharmacists can actually come to you to provide these vaccines. So we've done that in the past. We've done where we can do clinics. So if there's like a location where there's a group of individuals who would need us to come out, we can do that. As well as we have done like home visits, you know, for flu vaccinations or those kind of things. And oftentimes, then you can kind of get up to date on the things that you would need at that time. So just always let us know if that would be something that you would be interested in, especially if it's something that you would need. So going places, we wanted to talk a little bit about our travel health program. So we have this great program for individuals who may be traveling outside, usually outside of the United States, around the world. There can oftentimes be oral medications that would be really important for you to take with you, either as prevention or in case if something does happen, like a traveler's diarrhea type situation, as well as there's a lot of vaccines that would be recommended for traveling to certain areas in the world. So we have this program you can actually go to the Jewel-Osco website. You would fill out a form saying where you're going to go. And then there is a fee associated with that, but then they would send a directive and we would contact you to let you know what would be the recommendations for any oral medications or any vaccinations that would be recommended for that trip. And then we usually are also able to provide you with any kind of safety tips for traveling in those areas. We also offer health screenings. So some of the major ones that we offer commonly are A1C, blood sugar or blood glucose, blood pressure, BMI, and lipid panels are some of the most common ones. And those are typically ones that we can do on the spot. So we'd be able to do and get you those results while you were at that appointment. So those are very convenient. Oftentimes you don't have to make an appointment, but occasionally it might be easier if you wanted more of a sit down with the pharmacist to kind of plan the best time for that. And these health screenings, we are not able to bill insurances, but oftentimes we're better than the price of the copay of going to the doctor or going to get your blood work other places. So just let us know if you were ever interested in any of these services. The other ones, such as like the C-reactive protein, liver function test, PSA, TSH, vitamin D, and there is like a group of other ones as well. I just didn't want to give you too many options there. Then those ones actually would be a mail out, but you typically get the results within 48 hours of that one. So again, it's kind of about the convenience and hopefully to save you a little bit of money on like co-pays and things like that. We can always send those results to your doctor as well. So medication therapy management. So this is the one that I was talking about, making sure that you have the most appropriate medications, help you to answer any problems or side effects that you might be experiencing. Is there ways to prevent those side effects? Is there other medications that may be more appropriate for your situation? So we can help with these services, so optimizing the therapeutic outcomes, so making sure that you stay healthy longer that one to prevent any bad reactions or any problems from the medications. We can reduce also like your healthcare spending. So oftentimes we'll have individuals come in and talk to us about, if anybody is on insulin or on any of these very high cost medications, it can be devastating to get some of these costs for that one. So sometimes we can help to make sure that you're on the preferred medications, or we can find out what would be the best approach to keep the cost down as much as possible for some of those medications. So definitely let us know if there's ever a medication that you cannot afford, or that you would need help with, because if you don't take the medication, if you're not able to take the medication, then you're not able to help the situation going on. So sometimes there's different alternatives for those medications. So ask for a complete medication review. So these are individual appointments with a pharmacist where we basically go over all the medications that you take. And so all the prescription medications, all the over-the-counter medications, which basically all that means by over-the-counter is just things that are in the aisle. So things that you don't have to have a prescription for. So that would be things like for pain medications, so Tylenol, ibuprofen, Advil, anything like that. Anything for colds, anything vitamins, supplements, anything like that would be considered over-the-counter kind of medications. And then so we can kind of review those medications, because oftentimes when we're checking a prescription, so if I'm at the pharmacy and I'm checking that you've got an antibiotic coming in and a blood pressure medication, I am only looking at those two medications. I'm not looking at the fact that you may be taking Tylenol also, or you may be taking cold medication or something else. Hey, bless you. So that helps us when we do these medication reviews to ensure that we have everything on file that could interact with other things. Because just because it is something that you don't need a prescription for doesn't mean that it's safe. So there's plenty of interactions with those kind of medications, there's plenty of potential concerns, and so us having a better picture of that helps us to keep you safe. So the appropriateness of the medications we can assess during that. So there's oftentimes guidelines will change, there'll be better recommendations for certain things. So some people just stay on the same medication for a really long time, and then maybe they're not on the most effective medications at helping to prevent against things like heart attacks or strokes, or prevent against damage to the kidneys or whatever it might be. So that can help. We can help to kind of make sure you're on track with the current evidence that's available. We can, as we talked about, cost savings opportunities, adherence issues are also discussed. And then we can do training and education provided on all medications. So any medications that you may have questions on, we can always help you with that. We go to a lot of schooling. We love to talk about medications. It's like our everything to us. So for that one, so we would love to talk to you about that and help make sure that you feel comfortable with your medications and have all your questions answered. So chronic condition management. So there's a lot of chronic conditions that we can kind of help to help with those specific conditions. Some of the major ones are asthma, chronic pain, diabetes, dyslipidemia, which is just your cholesterol levels. So if there's something awry with your cholesterol levels, hypertension, which is also high blood pressure, and migraine headaches. We also can do blood glucose monitor trainings. So if you have a new meter that you're using for your sugar levels, we can always go over that information with you to ensure that you have the proper, how to properly use that machine, and then we find the one that fits best for your situation. So some of the additional pharmacy services we can offer free automatic refills on the medications. That can be helpful just as a reminder. So it'll send you a reminder call or text. So if you're like me and don't have the greatest memory, it can help to remind you that, oh, I do actually need to pick that up. Prescription delivery, there's also text messaging. If you're tech savvy, there's like a nice little app and text messaging that can help to remind you as well. There's various insurance plans that are accepted, various discount programs available, and kind of going back to the various insurance plans, there's actually some insurance plans that we're preferred under. So you actually might be getting a better copay from us by coming to Jewasco Pharmacy opposed to somewhere else. From that one, we can do blister packing, where we package your medications into little containers, like kind of the ones that you would pop out each day. That one, so that can help to kind of make that a little bit easier if you're feeling kind of overwhelmed by the number of medications. Pet medications, so if you have pets at home, we're typically able to fill those pet medications, and oftentimes it can be for a better price than maybe at other locations. And we have many locations, we have hopefully convenient hours for you, and then knowledgeable and friendly staff. So I want to talk just quickly a little bit about some of the kind of just generic topics about medications in older adults. So in adults 75 and older, it's over 33% are taking more than 5 medications. So I think that's extremely important to kind of emphasize, because that can increase the risk of side effects from the medications by 88%. So as you add on more and more medications, there's more and more likelihood of there being side effects and also interactions with those medications. So that kind of emphasizes the idea of making sure that we know everything that you're taking, and that if you do, say you were in that, you're having a pain or something like that, you need to get a medication, then just walk up to the pharmacy and say, or go to your pharmacy, say, hey, is this okay with the medications that I'm taking before you do take it, or call us, so you can always call us on the phone as well, just to make sure that you're protected. So medications included, I already kind of talked about that includes both prescription, over-the-counter, supplements, and herbals. So medication risks to be aware of. Oftentimes, many medications can cause dizziness upon standing. It can cause blurred vision, confusion, dehydration is huge. So that's kind of one that oftentimes gets overlooked because most of us are actually already dehydrated. So then if we add on top of it a medication that causes us to be even more dehydrated, then a lot of those symptoms, confusion, dizziness, blurred vision, become even more profound from that. So side effects like dizziness and confusion can put you at risk, and taking medications can mean more side effects. So making sure, it doesn't mean that we don't need those medications. There's many, many medications that will help you to live longer, live healthier, prevent some bad events like heart attacks and strokes, but you want to ensure that the medications are fitting what your goals are for your life. And keeping a medication list, this is extremely important. Any questions? Okay, sounds good. So keeping a medication list is extremely important. So again, including those over-the-counter medications. So literally everything you ingest that's not a food, that one, you would want to make sure to put on there. And then making sure to know the strength, the dose, how to take it, time of day to take it, and any special directions related to that. That can be extremely important to help the pharmacy ensure that we're looking at all the medications that you're taking, all the things that you're taking for interactions, but as well as if you go to the doctor's office, if you have to be hospitalized, or if you have any situation like that, that they are aware of those medications. Because oftentimes in those medications, if you stop taking them, you can put yourself into a really serious situation, and if you don't take them, you can put yourself into a very serious situation. So you want to make sure that there's always that continuity of knowing what you're supposed to be taking so you can keep up with those medications that are essential medications to keep you protected. So what are some smart medication use strategies to reduce your risk? So using one pharmacy is very important, and I know that that's a easy thing for me to say for that one. Then you have the idea of some people have to go mail order for some of their medications, and then they sometimes have to go locally for them. Sometimes it's a much better price at certain locations for certain medications. So I do understand that there are circumstances that would draw you to want to go use other pharmacies, but as best you can, try to utilize that one pharmacy and be aware if you're not using the one pharmacy. So for example, if you do have some medications on mail order and then you do come to a local pharmacy for some of your medications, make sure that both of those pharmacies are aware of all the medications that you're taking, because if you were to take something that was under a discount card at the pharmacy, so say you came to Jewel, got a medication, and was under a discount card because it was cheaper than your insurance, then your insurance company or the mail order has no idea that you took that medication. So they're not checking for the safety and to make sure that that's okay to take together. So you have less chances of the medication interactions. You build a relationship with your pharmacist. So we love our patients for that one. So we really care about you, and we want to kind of know what's going on. And it's not always so easy to just look at a medication list and tell you what's best for you. It's knowing you. That's what helps us to know what's best for your medication list, is knowing your situation, knowing what are your health goals, what are your current situations that make it appropriate and make you be able to take your medications as best as possible. Always keeping your pharmacy updated with any changes, and that doesn't especially include if you're going to multiple pharmacies for whatever reason that may be. So review your over-the-counter medications. So kind of making sure, this is kind of going back to if you are going to pull out something on the over-the-counter kind of section, making sure that the pharmacy is aware, but also asking them questions. So don't be afraid. So we're very accessible. We're at the counter on purpose because we're being there as a health resource for you. So making sure that you can kind of have any of those questions answered, even if you just want to make sure that this is okay, just always come and kind of ask us, and we'd love to talk to you about that. So talk to your pharmacist. Have I said that enough? Ask for easy open containers. So these can be something that can be very helpful, can seem very small, but could really make a big difference depending on your situation. So asking for easy open containers, you can always do that. Pill boxes, blister packing, and auto refills as those reminders. So some of those things can really make it a lot easier and give you a little safety net at making sure that everything is on track. So some of the references in cases. And were there any questions? was there anything that we didn't talk? Oh, yeah.
Are there computer programs that the pharmacies use that if you say have a person's total medication list and then the doctor orders something new and that is plugged into that list, that if there is potential problem, it will highlight it for you?
Yes. So kind of how the process works, and it's by law, so it's actually by law. So any legitimate pharmacy that you're going to has to do this process. So basically when you bring in a prescription, we have got to check under your profile of what are the medications that you currently have at that pharmacy, and we have to check for drug interactions related to that, side effects, is it appropriate for your age, whatever it might be, and we have to kind of look at all those factors, and we get alerts for those, and they're categorized as like a not such a big deal all the way up to, you know, very, very serious, don't do this, kind of warnings. From that standpoint, the problem comes into the play of kind of like this polypharmacy where somebody's at a lot of different pharmacies, or they're taking a lot of over-the-counter medications and we don't know about that. So those are kind of where the concerns come, because that system only knows what's been inputted into it. So if I don't know that you're taking a lot of over-the-counter medications, then I'm not able to check those for those interactions, things like that.
But that's really good, because when people have several different doctors, sometimes the doctor orders something, he doesn't know what the other, you know.
And that's where the root of this came from, was the idea that if you had many providers, or if your other doctor hadn't been talking to your other doctor, or whatever it might be, that we're kind of bringing them all together. And then as we've kind of branched into having a lot of different pharmacies, having mail order, having those kind of other options, then it's caused it to be a little bit more kind of broken up. So it can kind of risk increases with that process. But if you just can come in with your medication list, we can always just add anything that we don't get under under our pharmacy into the system, and then it will always check every time we fill a prescription. Was there anything that I didn't talk about that you would like me to talk about?
You were very informative.
Oh, thanks.
Yeah.
I appreciate it.
Very nice presentation.
Thank you very much. Thank you.
TRIAD works to improve the quality of life for seniors by providing an opportunity for the exchange of information between public safety, social services, and seniors. There are no membership papers to fill out or fees to pay. Everyone is welcome to attend. Each month, we present a guest speaker on subjects that keep you informed and up to date on the latest scams, frauds, and other criminal activities. We also discuss safety issues, home preparedness, and staying healthy. TRIAD meets the fourth Thursday of every month. Contact the New Lenox Police Department at 815-462-6100 for more information.